wanted to go through a very, very important conversation today, which is the key factors that cause a UCL injury. And the UCL, or ulnar collateral ligament, is the ligament that is also known for the Tommy Johns. When you get that surgery done, it's also the UCL ligament. But the reason I just wanted to call it UCL injuries instead of Tommy John is because there's a lot of UCL sprains, strains, things like that happen to the UCL that also end up to cause a significant amount of time missing, and also give people a lot of kind of anxiety about the injury itself. So I just want to give a little bit more information about what exactly the UCL is, what kind of causes these injuries, ways of how you can prevent, always trying to get you guys more valuable content. So we'll hop right into it. First, so the UCL is a ligament. It attaches right into your ulnar bone, which is right down here in the arm, and it attaches right into around this area here. It is the actual ligament, and there's really three different parts of it. There's an anterior part, there's a posterior part, and there's a transverse part. The part that you usually get injuries for is on the anterior and the posterior part, and the reason it is because that ligament, it's very similar to the knee in that it really holds the elbow together. And so if we're going back into external rotation here, it makes sure that my forearm just doesn't fall off, right? Just like how the ACL is that my ACL makes sure that if my knee goes inside here, then I just don't lose my entire knee. So what I want to be able to do, or what I'm, in order to best address this UCL problem, is by mitigating or trying to minimize as much of that over external rotation that we can. And this is one thing that we talk about a lot when you come into the lab, is that look, if you can, and you can see it a lot too when you're breaking it down and have a lot of frames per second with all the cameras and everything like that, you can see as people are coming through, they get into this tremendous amount of external rotation within their arm. And one of the big things that we try to do to resist that is actually building up the core. And the reason that is because if you look at me, and if I just go into external rotation with my arm, you can see how much external rotation I get to. But then if I go into extension of my spine, which would be the opposite of activating in the abs, just allowing my spine to extend, now look at how much external rotation I get into, okay? So a lot of times when you see pitchers coming through, they're getting into so much external rotation within their backs that they're able to externally rotate also within extension within their backs. They're also able to get so much external rotation within their arm that they're putting themselves at risk for overly extending within that UCL ligament. Okay, so that's a big key thing that you want to do when you're trying to address this UCL, is make sure that your mechanics are right. We need to make sure that you have good core activation, you use the right parts of your body, and you're not allowing that back to get into so much hyperextension that you're losing control of the shoulder and putting too much stress on the UCL. There's different things you could do within the actual motion as well, obviously, but we can maybe make some more videos about that. If you have any questions about that, please email me, Morey, M-O-R-E-Y, at yourperformancelab.com. We can get more intense into, some parts you can do within the actual throwing motion. But we want to go more into some of these other issues as well. The other one would be a really high pitch count or lack of rest. And so what is happening here a lot is that it's just becoming too important at a young age to, win the 10-year-old youth championship or the 11-year-old youth championship, whatever the case may be, and also trying to, play for so many different teams. It's like, it seems like within the baseball community, it's one after the other of different types of games or practices, or playing on a travel ball team, doing different types of showcase, and every single time you're doing that, you're just making it so you're increasing the count, and it's a ligament. So the thing about a ligament is that it's constantly under tension. So if you're going to go and always throw on it, always stress it, now you're going to take it into further and further stretching that it's never gone to before. And the more you do that, you're increasing your risk of spraining, straining, tearing. All those things are going up when you continue to have a high pitch count, when you continue to go to different showcases, trying to throw as hard as you can. I think just varying the level of competition, I think also really increases your chance of having an injury as well. And so what that means is there's sometimes that you'll play for a 12U team and then the 14U team will need you, or you're playing for a 12U team, but then you have an opportunity with like a high school and you go do that. But if you vary these different competitions, all of a sudden you're throwing the ball hard. Again, your chance of having an injury is coming up. And also take some more time off. Take about a month or 2 months off in order to grow. I know that within the for football players, we always have to take at least 6 to 8 weeks off every single year to make sure that we're able to fully develop and get through any past injuries. And so I think that pitchers don't necessarily think that they need maybe the same amount because it's not as straining on the body, but I think that it's not true. I think the pitchers, or really baseball players in general, can use 6 to 8 weeks to really grow and allow their body to fully develop. Okay, last thing is age. The reason I say age is because when you're 9, when you're 10, when you're 11, your ligaments, your muscles, everything, your joints are all bending in super crazy ways that you're a lot more flexible. You have much better what's called tensegrity. And so if we can make it so we can, when you're throwing a lot, when you're in these age groups, you can start to rely on a large amount of external rotation in your pitching motion because you're such a young age. I mean, why would you don't have as much limitation within your body. As you get older, though, you start getting into your 20s. If you have a reliability for having a lot of external rotation because you develop that movement pattern when you're really young, now that's what's going to actually increase your chance of UCL. I don't think that it's necessarily, poor mechanics come into it because if you're 11, 12, and you're learning that going into that large amount of external rotation is okay, then yeah, once you get up to 20, then it's going to end up, coming up and biting you. So, that's a big part of it as well, is when you start. But the bigger thing to me is when you're younger, trying to really develop the right mechanics when you're young. Let's make it so when you're at this age, let's make you much better at understanding where your power should be coming from. It's not about trying to get as much external rotation and trying to, go and put a ton on the elbow and creating force. We want to be able to better use the legs, be able to push off the mound better, be able to get more transverse plane activation, control that core of the transverse plane is being able to rotate, control that core, that spine. Those are one of the important things that we need to be able to do, and also teach kids, at a young age, so then when they get into their 18, 19, 20-year-old time period, then they're not relying on that large amount of external rotation. So again, those are 3 very, very important things that you can put into how we can reduce the likelihood of UCL injuries. I think this will be a very, very valuable video for anybody that is having UCL problems, or a younger, older pitcher that is maybe having some type of insecurity about their elbow or any significant problems that they might have. I think this will really, really help in clarify anything. Again, if you have any questions, please email me, Morey, M-O-R-E-Y, @yourperformancelab.com. We have throw breakdowns. I'd be happy to break your throw down. We also do different things within our membership, our YouTube. We're trying to provide as much value for you as we can. Please let us know how we can do that, and we'd be happy to make that happen. Thanks again for watching the video, and we will see you soon.